What is going on, everybody? This is Dr. Sam Watkins from MoveMend. And for those of you who haven't tuned into a live stream before, who are new to the community, welcome to the ACL Physio Coaching Community. This platform was created by the MoveMend Rehab and Performance team to improve ACLers through education and empowerment. The topic of the day today is going to be on running. So I'm talking all things running. Well, I guess not all things running, but I'm going to be talking more about the return to running, return to jogging, and just running throughout the ACL process, but not necessarily getting into sprinting, change of direction work, high intensity, kind of more sport specific things. Just general running is what this is all about. And I think it'll be valuable. It'll be some good content for you guys. But before we jump into that, just some housekeeping to jump into a little bit here. If you're new to the community, welcome. I hope you've found it useful. There's some really good information for y'all on here. If you are new, it's always great to introduce yourself. Right? Go on that main discussion feed, say hello, tell us a little bit about your story, what your journey's been like, what you're struggling with, what your successes have been. It's a good place to drop questions that we can answer. Myself and Dr. Mika Riley can answer. And you can also hear more about what other people who are going through ACL rehab are dealing with as well. So definitely introduce yourself. If you haven't had a chance, the roadmap is a great starting point on the page to just get some very clear-cut information on the rehab process, right? All the way from I just tore my ACL and I haven't had surgery yet through return to sport. So check out the roadmap. This live stream and all other previous live streams are under the free webinars tab. So there's been a ton of topics that we've discussed. And if there's anything that you feel like you want to learn more about, take a look in that free webinars tab and see if there's anything in there already that might answer your questions in more detail. There's a lot of things in the roadmap are explained in the roadmap, but we dive into it to another level in these talks. So definitely check those out. And also feel free to reach out to myself or Dr. Mika Riley in the DMs to ask any questions you have. We're happy to help out. Last but not least here, before I jump into running, I just want to announce a live stream that we have coming up that we're pretty excited about. So Dr. Mika is going to be chatting with Dr. Grant Garcia. He's a surgeon in Seattle, and he works with a lot of ACL clients. He actually did Mika's surgery, so you'll hear from the two of them about the process and about the decision making behind her graft and some of his other opinions on surgical processes as well as some of the rehab process. So that's tomorrow, Wednesday at 5:30 p.m. Pacific time. So make sure to tune in for that, or it'll also be on the in the free webinars tab once it's finished. So definitely check that out there. I think it'll have some pretty cool information. It's a pretty unique opportunity to sit down with a surgeon and hear what they think about ACL injuries and the whole recovery process. So hang on, I got to clear my throat here. Excuse me. So before I jump into running, if you are tuning in live here, got a few of you guys coming in and out, feel free to pop any questions into the chat. I will definitely try to carve out some time towards the end here. Try not to talk at you for too long, but I'll carve out some time to answer any questions you do have in the chat. And these are always useful hopefully for you. Hopefully you can get some good information, but also for anybody who's tuning in live or also for people who are checking it out later. But yeah, getting into running. So first, this is not medical advice. As I always say on these streams, I don't know your specific situation. I don't know what procedure you had. I don't know if you have any specific precautions, if you have any sort of other health issues beyond ACL injury. So I can't speak. This is not speaking directly to you. And this is for educational purposes. I think there's some great information for you in here, but definitely talk to your surgeon, talk to your physical therapist before you apply any of what we talked about to your process, your rehab process. So running, like I said, we're getting into running, and it's more about the return to running after surgery and using running in the rehab process for fitness. Like I'm talking like going out for a run, not training for your 5K. I'm not talking about training for top end speed right now. We'll talk more about that in some future live streams where we talk about getting your max sprint speed back, where we talk about getting springy and athletic and changing direction well and returning to field sports, that kind of running. That's not going to be touched on here. This is more getting back into running and how I like to think about using running from a fitness standpoint throughout the rehab process. So just so we're clear here, running it's looked at as a milestone, right? And oftentimes people are excited to get back to running after surgery, which I totally understand, right? You had surgery a few months ago. You're feeling kind of like you've been locked down for a while. You've gotten back into some strength training, but you just want to get out and move again. And I 100% understand that. But it shouldn't be rushed. It's something that needs to be earned, right? You need to have developed a certain level of strength. You need to demonstrate a certain level of plyometric ability. You need to be able to demonstrate that your knee can handle the amount of stresses, that running is going to place on the knee. And you'll get there. You will get there. It just is going to take time. And the work that you put in those early stages, those first few months, is going to set you up for success to run, quote unquote, on time. And we'll talk about the time-based criteria, but there's no super strict timeline about when you need to run. So yeah, let's just jump into the criteria for returning to running. I've got a pretty strict criteria I like for people to be able to meet before they return to running. And that's for a number of reasons. It is all things that if you didn't have any injury would be very easy to do. And so it's not strict in terms of like, oh my God, he sets the bar so high to return to running. But after having a surgery, these things are going to be a challenge for you. And you will need to put some work in to be able to get to this point. There are a number of tests here, so I'll just list them off and I'll go into some more detail. One, this isn't really a test, but it is a criteria: time, range of motion, strength, and then dynamic capabilities. So being able to move somewhat athletically to be able to jog. That's really what it comes down to. And so if we are thinking about time, right, that's one criteria. I say time, not in that like you need to be running by a certain point, but in that you need to be at least the 12-week mark before we can even consider starting to jog. And this is where we're looking at the amount of stress that your recently repaired ACL, the amount of time it needs to be able to handle the stress of running. And that is at least that 12-week mark. So that is a criteria. That doesn't mean that at 12 weeks you should be running. That's not what that means. It is just the minimum time at which you should consider getting back to running if all of these other tests are passed. Like I said, there's no strict timeline about when you need to be running. I don't rush people into running. I'll talk about certain situations in a little bit here after we talk about the criteria a bit more. But 12 weeks minimum before you should consider getting to running. And that's just the amount of time your ACL needs to heal. So by that point, your ACL should be healed enough to be able to handle the stresses of running. And if you go and run on a track and you don't do something crazy and don't go way too hard and don't cut and pivot, your ACL should be strong enough to handle the stresses of a jog. That's what that comes down to. Beyond time, as a criteria, these other tests are all indicators that your knee is actually ready to be able to handle running without getting super irritated and resulting in a setback, right? I've seen a ton of people who come in to me for a second opinion after 5-6 months. They're feeling like things aren't moving in the right direction. And they said that their PT, who was following the criteria from the surgeon, had them start running at exactly that 12-week mark. And it was painful. It was sore. And the only criteria they used was that 12-week mark to decide to return to running. And what that does when you don't look at strength, range of motion, these other dynamic capabilities, it sets your knee up for getting super irritated, so you can't actually work on targeting the other deficits that you have. So beyond time, we're looking at sensitivity of your knee. So a quiet knee, your knee should be feeling pretty good by this 12-16 week mark when you're considering returning to running. So that quiet knee is a criteria. You should be able to take part in your home program, your strength training, your daily life, and everything without feeling like your knee's super sore, without feeling like you're having swelling after the fact. Range of motion. Before returning to running, you got to have full extension range of motion and pretty close to full flexion range of motion. Sometimes, especially if you've had maybe like an LET, the lateral external tenodesis. It's a newer procedure that tightens up the joint a little bit, makes getting flexion a little bit tougher, where sometimes by 3-4 months, people are missing a couple degrees. But you definitely need to have full extension range of motion and at least pretty close to full flexion range of motion. Beyond range of motion, we're looking at strength. I want to see at least 70% quad strength and hamstring strength on the surgical side compared to the non-injured side, which hopefully you've been training as well, so you're not comparing it to a weak non-injured side. And this does also mean that your PT should be assessing your strength objectively and not just pushing on your leg. If someone is pushing on your leg to tell you what your quad strength is, that number doesn't mean anything. That is a super, super outdated method of strength testing that, in my opinion, it does not tell you anything. Like, just for example, you should be able to push around your body weight from your quad. And if someone is pushing on your leg, they're probably pushing with less than 50 pounds of force, or maybe 100 pounds. But unless you're a tiny person, that is not giving you any real information to determine return to running, and definitely not anything about to return to sport criteria. So strength, 70% quad, 70% hamstring strength, which means you need to be tested appropriately. And then if we're looking at more of the dynamic capabilities, there is a little battery of tests I like to run with people, which are more than 15 single leg squats. So where you're sitting down to a bench or a chair and standing up on one leg. You should be able to do 20 reps of a single leg bridge. So having okay hamstring strength, glute strength, and endurance. You should be able to do more than 20 single leg calf raises. You should be able to do more than 15 single leg vertical hops. I'm not saying vertical jumps where you're doing like a big max effort jump, but 15 small hops, and then more than 15 forward hops. All of these movements should be pretty much pain-free. They should be able to be performed with pretty good quality. They might not look as good as your other leg, but you should be able to do those 15 hops, those 15 squats, and those other tests with pretty good quality. And again, we're kind of looking at two sides of things here, right? Time just tells us that your ACL is recovered enough to handle the stresses of jogging. These other tests show that you have developed enough strength and control and tissue capacity to be able to handle the stresses of light jogging. These aren't tests that clear you for sprinting, because these are nowhere near the demands that hard changes of directions and sprinting put on your knee. But these are tests that show you can probably handle some amount of jogging if you can do these things without pain and with appropriate control. And so we'll jump into my return to running protocol in a little bit here. But all of this, for everyone tuning in here and who's checking this out later, is all spelled out in more detail in the roadmap. So definitely check that out if you haven't had a chance. In the mid phase, there's a return to running section that details the return to running criteria. It talks about the return to running protocol that we like, and I'll dive into that one in a little bit here. But definitely check out the roadmap if you want some more information. It gives some of this stuff is all spelled out here. So if you're vigorously taking notes, just go check that out. And we'll dive into some more here though. So if we're talking about the use of running in rehab. So for me, as someone that works with a lot of people going through ACL rehab, I'm in no rush for most people to return to running, right? It really depends on what they're looking to get back to in the long run. That helps me decide how quickly I want someone to get back to running. So let's say if someone is a lineman in football, a big guy who does not do a lot of jogging, I'm in no rush to have them run. And that is because they are, I think maybe with them being so big, they maybe are a little bit more risk of overdoing it and irritating the knee. But two, running is not going to address the strength deficits, their dynamic capabilities, or anything else in a way that's going to help them actually return to the tasks that they are looking to get back to, right? Me having someone at 5 months who is 250 pounds and looking to get back to Division I football them getting back to running is not going to drive their severely depleted quad strength better than strength training. And it could take away from them building strength with the gym work, right? If someone's prioritizing 3-4 days of jogging, that's not going to be helpful for developing their quad strength, especially if they have a big deficit that they need to make up for to do something dynamic like pushing huge people on a football field, right? Now, on the flip side, if someone is a track athlete or a soccer player, getting them back to running at the 3-4 month mark gives them, one, a nice outlet. They probably like to run because that's a part of what they do. But two, it helps them develop their fitness, develop some of the dynamic stability that directly pertains to the sports that they are looking to get back to. Now, it's not going to be the thing that's going to help them develop their strength and control and power to be able to get back to pivoting and cutting, but it is going to be important for them to have good fitness running so that they're building up a nice base. So when they are actually cleared to sport, they have gotten 4 or 5 days a week of running and jogging in, and they have a nice base of fitness, right? Versus waiting until the 10-month mark before we start getting them jogging regularly, waiting till they get their full strength back before we start getting their fitness back up, right? But just in general, even if you are a soccer player or a track athlete or someone that hopes to do a lot of running, running should not be the priority for your program. And I know it can be a little bit counterintuitive, right? Because if you're getting back to running, yeah, you finish a 30-minute run. If you're pushing a little bit, your legs are a little tired, for sure. But it does not target the main deficits that we need to be hitting to actually drive adaptations in strength and power and other metrics to return to higher level activities, right? There's a reason why marathon runners don't have gigantic quads, and it's because they aren't actually targeting high load movements to build muscle mass and strength. And after surgery and after an injury like an ACL injury, you're going to have a deficit in strength. And we need to directly target these deficits in order to improve them and actually return them to normal. And so running shouldn't be a priority. And the way I look at it is that it should not take away from your ability to actually target these more important deficits, right? An analogy I like to give people is that running for developing your strength, using running as your main method of developing strength, is almost like trying to learn a foreign language, learn Spanish, for example, by just putting the subtitles on TV when you're watching TV. Like, yeah, if you're paying attention to the subtitles, you might get something out of it. You might learn a couple words especially if you already have some background there, you might get something, but you're not actually going to see major improvements in your Spanish as compared to if you took lessons and practiced grammar and try to memorize vocabulary, right? That's directly learning in the same way that strength training and targeting your muscles in a very specific way is going to target your strength, while running is going to be, giving you something, but it's not going to get you to the point of being fluent in Spanish. So that's an analogy I like to give, especially for people that don't have a lot of experience with strength training in the past. But even more reason why doing true objective strength testing is important, so you can see those numbers go up, and you'll see how strength training is huge there. So yeah, in summary with that, your running, even if you are a soccer player that needs to be fit by the time you get back to your sport, should not take away from your ability to do your gym work. That is a non-negotiable for me. If a client wants to run 4 days a week, but because they are doing that, their knees too sore or their legs are too tired to actually push in the gym, then we need to cut back on the cardio until your knee can handle it better. That's just the unfortunate reality. There is, for most people, a nice happy medium where you can get out for a 20 to 40 minute run a few days a week and still kind of scratch that cardio itch and still see fitness gains without taking away from the gym work. But if you're not actually building that strength back, then the idea of getting back to skiing or soccer or volleyball or football, whatever these things are that require more strength to be able to cut and move well, it doesn't jive well. So that's kind of my thought process there, and hopefully that makes sense to you all. Before I jump into the very simple return to running protocol I like to use, I do just want to remind you that if you are tuning in here, feel free to drop any questions in the chat. I'll make sure we carve out a few minutes to answer any of those. But my return to running protocol is very straightforward. So if someone's at least 12 weeks out and has passed all of these tests, then we can get back into some jogging, but it's not going to be going full throttle. It's going to be a progression that I think is pretty reasonable, and is a little bit less tedious than some of the ones you'll see out there. Like you'll see some running progressions out there that are jog for 1 minute, walk for 5, do that for 5 rounds. If that goes well, you add 1 minute of jogging. I get that you want to be cautious. I get that you want to make sure you don't overdo things, but I don't think we need to be quite so regimented with the return to running protocol. So my return to running protocol is very simple. You go out, and if you've passed these tests, you've demonstrated that you should be able to handle some amount of jogging. So I have people jog for 5 minutes. The first time I cap it at 5 minutes at a jog pace, like a nice, comfortable little trot. We're not pushing it here. We're not trying to go for a 5K record. We get out and jog for 5 minutes. And if that goes well, then 2 days later, they jog for 10 minutes. Same thing, 10 minutes max, nice trot. If that goes well, 2 days later, they can go out and jog for 15 minutes. And they continue to do that until they reach a point where they are, where either their knee gets sore, or until they're running as much as they feel like they would like to. Pretty quickly there, in 2 weeks, you built up to, as long as things went well, you built up to a 30-minute run, which, considering you haven't run for 4 months, is probably enough to feel like you're pushing your body a little bit, and can be a nice level where we're not detracting from your ability to actually train in the gym. Now, if let's say you get to the 20-minute mark and you find the next day on your day off, your knee's feeling a little bit sore, that tells you that, all right, next run, we drop it back down 5 minutes. And so you're sticking to 15 minutes for a couple sessions until you're feeling like it's totally fine. And then we build that back up to 20. If that feels good next time, then we go back up to 25. And there's some other variables at play with the other strength training you're doing, making sure that that in combination with this running isn't what's overdoing it. And maybe some tweaks need to be made on the strength training side of things. But that is a nice, simple running progression that still gives us enough flexibility and has small enough jumps where if we overdo it, and if you overdo it by 5 minutes of jogging and you're a little sore the next day, we just probably kind of crossed that line, crossed that threshold of what was too much. We didn't go and jog 20 extra minutes and way overdo it. And now you're sore for 3 weeks and we can't actually run or train properly. So that's my general running protocol. That's about all I wanted to get into today. I hope that all jives well with you and aligns with what you've been hearing about from your PT, aligns with what you've been hearing about from your surgeon, with what your surgeon's protocol says for return to running. And it might not. I am definitely a little bit more conservative in some ways where I want people to actually be able to demonstrate that they can handle a task before I have them go out and do it. But if anything, my two main takeaways for you all today are, one, the criteria. You shouldn't just get out and run because you're at 14 weeks and that's what your protocol said to do. You should be able to demonstrate you can pass at least this battery of tests that I've mentioned and that you can review in the roadmap, because those are signs that you actually will be able to handle running without totally pissing off your knee and detracting from your ability to target strength deficits. And the other takeaway from this should be that your running should not detract from your ability to do your rehab and gym work. If it is, then you're missing the boat. You have plenty of time to build your cardiovascular fitness back up down the line, but the longer that you delay actually targeting your strength deficits, targeting your power deficits, the longer it's going to take for you to return to sport, because those are the things that really change your risk for re-tear, right? You getting back to skiing at 10 months depends on your ability to have full quad strength, full hamstring strength, perform single leg hop tests, look good cutting and doing things like that, not about being able to run hard for 45 minutes. So definitely try to find a way to work in running from a fitness standpoint during your ACL rehab, but you might need to find a balance so that you're able to actually do your rehab and get back to the stuff that you want to do. So I think there's often, I actually don't think I've had an issue with finding a balance for every client of mine. Yeah, you might need to make some compromise, but it's just the reality of rehab. And you'll get back, you'll get fit again, you'll get back to running as much as you want. But if you want to get back to these higher level tasks, running shouldn't be the priority. So, all right, guys. Well, it looks like nobody has contributed any comments or any questions in the chat, which is totally fine. But definitely feel free to chime in if you have any questions that pop up in any future streams. Like I mentioned, this stream will be available in the free webinar section here in the next hour or two. So it's something you can review down the line. But hopefully this has felt helpful. And just for those that are maybe tuning in late here, again, welcome to the community. If you're new, definitely say hi in the discussion section. Introduce yourself, tell us about your story, and feel free to DM myself, Dr. Sam Watkins, or Dr. Mika Riley with any questions about your ACL process. We're happy to help out, and that's the whole point of this community. We want to make sure that people are learning about how to best rehab their ACL injury, and also give people a place to hear about the journeys other people have gone on, because it's a tough process, and it can feel daunting. You can feel like you're alone, and just learning more about the ups and downs other people have is helpful for everybody. So, all right, I'll see you guys next time. Make sure to tune in for Dr. Mika's chat with Dr. Garcia tomorrow at 5:30 p.m. Pacific time. It's going to be pretty cool. But until next time, I hope you all have a good one. Bye. Assuming I actually can end this call. There it is.